Hey, you're probably saying to yourself, what is a doctor doing wearing a hood? Well, first of all, I'm from the hood, but that's besides the point. Have you ever been in a hospital before? They are colder than Alaska. Well, let's talk today about how to diagnose an ectopic pregnancy. Follow the professor. Let's get at it. An ectopic pregnancy is one where, instead of growing inside of the uterus, it grows instead inside of the tube. Where the cervix is over here. Note the white line representing the endometrial stripe, which indicates an empty uterus. Note also here a circumscribed area with a sonolucent center and white speckled calcifications. This represents a degenerating fibroid in the submucous position. Note the cul-de-sac, as is indicated here, the presence of a heterogeneous mass, which represents clot. Note the hypoechoic area, which represents liquefacted blood, and the hyperechoic area, which represents clot. Fast forwarding the image to a different point of view, notably, this structure here is the ectopic pregnancy, a sonolucent center surrounded by a hyperechoic ring or decidual reaction. Symptoms of an ectopic pregnancy include painful first trimester vaginal bleeding. The differential diagnosis includes first trimester spontaneous miscarriage, which must be ruled out. It is impossible for an ectopic pregnancy to grow in the tubes. It will eventually rupture and cause massive intra-abdominal hemorrhage. If caught early, surgery can be avoided altogether by the injection of a medication called methotrexate. An ectopic pregnancy is a medical emergency in that there is no way for the pregnancy to grow without rupturing.
This is an example of an ectopic pregnancy. Usually the ectopic pregnancy is located in the distal portion of the tube called the ampullary portion, but in this particular case, this is an isthmic ectopic pregnancy. It's located in the proximal portion of the tube, and here it is. This is the gestational sac right here. This gelatinous substance right here is the amniotic membranes, and the growing fetus would be in this area. And reconstituting it, it looks like that. So this is an isthmic ectopic pregnancy.
So now you have it. Now you know how to diagnose someone with an ectopic pregnancy. Take it from someone who's been doing it for 30 years. Thanks for dropping by and visiting with the professor. And oh, here's a pro tip. Don't prejudge people. It's not important where a person comes from. What's important is where they're headed.